Hello?
Hello. How are you this morning?
Good. How are you?
Good. I'm just rubbing this gel in my hands here. Kylie, it's good to see you again.
You too.
And today we're going to be doing a full head-to-toe assessment.
Okay.
I'm going to be asking you questions in the first part of the video. The second part, I'll be taking a listen to you. And I'll be palpating joints and reflexes. And we're going to just do the whole head-to-toe shebang today, okay?
Okay.
Okay. And we'll look at your name band here. If you can tell me your name and date of birth.
Kylie Dallas, 31199.
Okay. And do you have any allergies?
No, ma'am.
No? No allergies?
Mm-mm.
Okay. Do you take any medications?
Nope.
Okay. Do you have any past medical history? Do you have any illnesses that you can tell me about?
I got my... Which one was first? Okay, I got my appendix taken out when I was in like the 3rd grade.
Okay.
And then my tonsils and adenoids when I was about 12.
Okay.
And then just recently I got my gallbladder taken out at 17.
Okay. And you don't take any medications?
Mm-mm, just ibuprofen every now and then on my menstrual cycle.
Okay. Tell me about your parents and your grandparents. Do they have any illnesses?
Both of my parents are very healthy. My grandparents on my dad's side, they don't have any issues either as far as I know. But on my mom's side, my mom's dad, he was just recently diagnosed with lung cancer.
Okay.
But he's actually doing way better.
Okay.
So, other than that, they're all pretty healthy.
Okay. Who do you live with?
My mom.
Your mom? Okay. Who lives in the home with you?
Me, my mom, and my brother.
Okay. Do you use tobacco?
No.
Do you drink alcohol?
No.
Do you do any illegal drugs?
No.
Or
No.
legal drugs?
No, ma'am.
Okay. All right. I think that's about all the questions that I have to ask you. We're going to be testing your vision this morning.
Okay.
Over here on the wall behind me, I have an eye chart. If you will read the lowest line that you can read, if you will cover up each eye and read the lowest line that you can read for me.
Does it matter which eye I cover first?
No.
Just as far down, the one that I can see the farthest?
Yes.
D, E, F, P, O, T, E, C.
Okay, very good. Okay.
Oh,
And if
okay.
you can...
D, E, F, P, O, T, E, C.
Yes. Okay. I'll take that. Now, the line that you've read indicates that you have 20/20 vision in both eyes. Okay? All right. Have you ever been to an eye doctor?
When I was younger.
Okay.
Well, growing up throughout school, I went all the time.
No vision problems?
Mm-mm.
Okay. Do you have no glasses, no contacts?
No.
Okay. Very good. Okay. Now, what we're going to do now is called a confrontation test.
Okay.
I'm going to take, well, actually, I'll take this. It's a Q-tip, okay, with the white tip.
Okay.
I'm going to ask you to cover your one eye at a time, and I'm going to bring this Q-tip into your vision, and you tell me when you can see it.
Okay.
And I need you to look straight, cover one eye, look straight ahead at me, and you tell me whenever you can see this Q-tip come into your field of vision.
Okay.
Okay? We'll start. Okay?
I can see it.
Okay?
I can see it. I can see it.
Okay? Do the next eye, please.
I can see it. I can see it. I can see it.
Okay. Now, what we're going to do now is the 6 fields of vision, okay?
Okay.
Looking straight ahead at me, I want you to look at me, but follow my finger as it moves, okay? Cover up one eye, please. Okay, there's my finger. Follow my finger with your eye.
I thought I was supposed to look at you.
Look at me. I mean, look straight ahead, but then when you see my finger, follow my finger with your eyes. Okay. Okay. Next eye, please.
Okay.
Are you focused?
Yes.
Okay. Finger here.
Okay.
Follow my finger with your eye. Okay, very good. Now, I'm going to be just taking a look at your eyes here. Have you ever heard of your pupils reacting to light? It's called,
Like when you're outside and your pupils get bigger or smaller.
it's called what we call perla. It means that your pupils are equal in diameter, and they are, and that they're equal and round and reactive to light.
Okay.
Okay? Alright, so I'm going to bring this light in. What I'm looking for is that they constrict and that the other one constricts also too. Okay? And they both do. Okay? You have beautiful green eyes. Okay? I'm just going to take a feel here. You tell me if you feel any tenderness. What I'm looking for is just tenderness, swelling. Squeeze your eyes, and I'm going to try to lift your eyelids, and you keep me from it. Okay? Alright, very good. There's no tenderness, there's no swelling. You have fabulous eyebrows, beautiful eyelashes. Okay, open up for me. Right now, I'm just going to be taking a look at the white of your eyes. It's called the sclera. Just looking for the collar to make sure that there's no lesions on your eyes. Here, I'm just making sure that there's no drainage, there's no swelling. Okay. And no tenderness where I touch anywhere, correct? Okay. Alrighty. Here, the little pink part of your eyes here, it's called the lacriminal gland, lacriminal gland. And I was just looking to make sure that it's pink and puffy, and there's no, lesions or swelling or drainage. Okay. All right. So I also am looking at the lens of your eye to make sure that there's nothing cloudy about your lens, and that your eyes are clear, the lens is clear, the whites of your eyes are clear, and just anything out of the ordinary, and you look perfectly normal. I'm also going to, while we're looking, I'm going to ask you to look ahead at me, and this is a scope, an eye scope. I'm going to be looking into your eye. And what I'm going to be looking for is the retina of your eye. You've got blood vessels back there. You have a disc back there, blood vessels, all of that. I'm just going to be asking you to look straight ahead at me, and I'm just going to look into your eye, okay?
Okay.
So if you'll cover up that eye, look straight ahead at me. I'm going to be looking in there, and I see your retina. I see the blood vessels. They look completely normal. I'm also going to be looking for a red reflex. When I look in your eye, I see a red reflex, which is what I'm supposed to see. I see your disc, and the characteristics look normal. And the macula, when you look directly into this light, I'm looking at the macula, which everything looks completely normal. Okay? Now, if you could cover up this eye, I'm going to look in your other again, and I'm going to be looking at your retina. It's intact. I'm looking at blood vessels. None are broken. Everything looks completely normal. I'm looking at your disc. The characteristics of your disc look intact. And if you'll look straight ahead into this light for a brief moment, I will look at your macula, and everything looks completely normal. Okay? So you don't have any problems with your eyes. You don't wear glasses. Looks like you have 20/20 vision. Everything looks really good with your eyes, okay? Next, we're going to move on to your ears. And I'm just going to be inspecting your ears here. I'm just looking for any abnormalities. If I feel any place that is tender, please let me know. I'm looking at the outside of your eye. Your ear here. Looking for any drainage, any lesions. Everything looks to be completely normal. No drainage. Any tender spots? Okay, very good. Your canal looks intact. You don't have any built up wax. I'm looking here in your ear. Now with my light, you don't have any buildup of wax. There's no foreign bodies, no lesions. And look here, again, buildup of wax. No lesions, no foreign bodies, and no tenderness, correct? Next, I'm going to be taking this little scope where I can look into your ear, and I'm going to be just looking at your eardrum to make sure that it's intact and everything looks completely normal in there. And then I'm going to assess your hearing a little bit. Have you ever had any problems with your hearing?
No, ma'am.
Okay. All right. So whenever I look into your ear here, I'm going to use this little light, and like I said, I'm going to be looking at your eardrum and all the pieces of your ear just to look for any abnormalities. Okay.
Okay.
All right. So I'm looking in here and I see your eardrum. I see that it's opaque and a pearl color. Everything looks intact. There's no foreign bodies. There's no lesions. Looking at for your left ear, a 7 o'clock landmark, and I see that is all correct in there. And we'll take a look in the other ear. I'm going to look, I see your eardrum, it looks intact, it's pearl collar, opaque. And in the right ear, I see the 5 o'clock landmark. It shows me that you have the correct amount of pressure in your eardrum, okay?
Okay.
So now we're going to be doing a few exercises. I'm going to whisper, it's called the whisper test, and I'm just going to whisper in each of your ears. I'm going to cover the other one and whisper in this ear, and you tell me that you can hear it, okay? I'm going to include this ear.
Yeah.
What'd I say?
Elephant.
Okay.
Watermelon.
Okay, very good. Next, I have this little fork here. It's called a tuning fork. And what I'm going to be doing, this measures vibrations and sounds in your ear. One is called the Weber test and one is called the Rhine test. So when I hit this on my leg, it's going to vibrate. I'm going to place it on your head, and you tell me if you can hear in both ears equally the vibration. You be sure to tell me if you don't hear it equally, okay?
Okay.
Alright? That would mean that there's some issues with your hearing, okay? So I'm going to get this on my leg and I'm going to place it here. You tell me, do you hear it in both ears?
In both ears, yeah.
Do you hear it equally in both ears?
Yes, ma'am.
Okay. Alright, so next what I'm going to do is I'm going to hit this again. I'm going to place it back here on your bone, on the mastoid bone. And I'm going to put it here. You tell me if you can hear it and when you stop hearing it. Alright?
Okay.
And then I'm going to hold it out here in front of your ear. And you tell me if you can hear it. And then when I place it out here by your ear, you tell me when you stop hearing it. Okay?
Okay.
Alright. You hear that?
Yes.
Okay.
I hear
I'm going to place it here. You hear it?
Mm-hmm.
Tell me when you stop hearing it.
I just stopped hearing it.
Okay, alright, very good. I'm going to do the same thing here with this
Okay.
bone and out beside your ear, okay?
Okay.
Oops, I dropped it. Okay. Alright, here we go. I'm going to hit it. Do you hear it?
Yes.
Okay, I'm going to place it in front of your ear and you tell me when you quit hearing it.
I just stopped hearing
Okay.
it.
Okay. Alright, next I'm going to be taking a look at your nose.
Okay.
You tell me if you feel any tenderness. Okay, I'm going to be feeling. Feel any tenderness? Okay, feel any tenderness here when I press on your sinuses?
No.
Okay, very good. I'll take my little light here. I'm going to be looking into each nostril. Here is called the septum of your nose. I'm just looking to see that it's symmetrical. Okay, I'm going to plug this nostril, blow out, breathe in. You have any problems on that side? I'm going to do the same thing here, blow out, breathe in. Any problems? Okay, so now I'm just going to be looking in there, in your nose to make sure everything looks good. No foreign bodies. I'm glad you didn't stick anything up your nose today. No discharge, no lesions. No trouble breathing through your nose?
No, ma'am.
Your septum is symmetrical. Okay. Alright. Now, your nostrils are patent. Like I said, you didn't have anything up your nostrils. Your sinuses are not tender. There's no swelling. There's no tenderness. Next, what I'm going to do is get you to close your eyes, and you tell me. What you smell. I put a little secret on my wrist.
Okay.
Close your eyes. Tell me what you smell here.
Peppermint.
Very good. That's peppermint. Now, if you'll close your eyes again, I have a different smell on this wrist. Tell me.
Fruity. Is it orange?
It is. It's orange. So that's some of my essential oils. So your nose works.
Okay.
Okay. Now next, I'm going to be looking at your mouth.
Okay.
And the roof of your mouth, under your tongue, and your teeth.
Okay.
If you would smile for me, really big. You have beautiful teeth. Very good. You have a good bite. Okay, I don't see any dental caries, any cavities. I do see one filling there. Now stick your tongue out for me. Okay, say ah. Okay. The little hang down in the back of your throat is called a uvula. I'm just looking to make sure that it is in the center of your throat, and it is. Lift up your tongue for me. Okay. Alright. No lesions. Everything looks good. Do you have any problems tasting? No? Okay. Your teeth are really, really pretty.
Thank you.
Your gums look really healthy and pink. Did you have braces?
Yeah.
Alright. Everything looks great. Now, if you will, I'm going to assess a cranial nerve while we're here, and I'll do all of them later on. But squint your face for me. Squint your eyes. Okay? Now puff out your cheeks. Keep me from pushing air out. Alright, very good. Alright, keep me from opening your eyes. Okay. Let me see. One more thing. Stick your tongue out. Oh, you don't have tonsils.
No.
You got them stick out. Okay, very good. Alright, one last thing. Stick out your tongue for me. I'm going to elicit a gag reflex. Okay, it worked. Okay, alright. So that concludes our ears, eyes, nose, mouth section of this assessment. So next we're going to move on to your heart and your lungs.
Okay.
Okay, I'm going to be taking a listen to you. I'm going to look at you, look at your chest and your back, and then I'm going to listen to your heart, and I'm going to listen to your lungs. Okay?
Okay.
Alrighty. Alright, first I'm going to put my hand here on your chest
Okay.
in the area of your heart. I'm going to be feeling for what they call thrills. It's like little vibrations or buoys. feel any of that, okay? Now next, I'm just looking at the symmetry of your chest, okay? Symmetry means equalness. So I'm just looking that your chest is equal. There's nothing out of the ordinary about your chest. And then I'm going to percuss. Here at your ribs is called intercostal spaces, okay? And based on intercostal spaces, that shows us where your heart is.
Okay.
So right now, I'm just feeling your rib cage and your ribs. Okay. Okay. Next, I'm going to be listening to your heart.
Okay.
Okay. And the areas that when I listen to your heart, I'm listening to the beats of your heart. I'm going to time your heart and get a heart rate.
Okay.
Okay. I'm going to listen for any extra beats or any heart murmurs. Have you ever been diagnosed with a heart murmur?
When I was younger, I had a super slight one, they thought, but I grew out of it.
Okay, very good. Okay, well, I'll be listening for that. I'm going to be listening for any abnormal extra heart sounds that shouldn't be there.
Okay.
And I'm going to be also, too, when I listen and I move my stethoscope, I'm listening to the heart valves.
Okay.
The valves in your heart opening and closing, that's what we hear. When your heart's beating, that's what we hear, or your valves opening and closing, okay?
Okay.
All right. So I'm going to take a listen here. On the right side, I'm going to be listening for the aortic valve, okay?
Okay.
Okay, I hear S1 and S2. I don't hear anything extra, no friction, no rubs. Okay, now I'm going to be coming over here and listen to your pulmonic valve at the second intercostal space. Excuse me, I got to fix my little stethoscope.
Okay.
Can you take a deep breath for me? Okay, I'm just breathing on it. I'm going to move over here to this side, to the right, second intercostal space, and I'm going to listen to the pulmonic valve. I hear S1 and S2. While we're here, I'm going to time your rate, okay? Okay, you have a rate of 66 beats a minute, which is normal. Your rhythm is normal. I don't hear any extra beats. I'm going to move down to the first point. Tricuspid. And the mitral valve. Okay, S1 and S2. Don't hear any extra sounds. Now, if I could get you to, it's called the left lateral recumbent position. If you'll just lay on your right side here, facing me.
On my right side,
This side.
it's my left.
I'm sorry. I mean on your left side facing me.
Actually, lay all the way down.
Please. And I'm just going to take a listen to your mitral valve in this position, okay?
Okay.
Now lift up your jacket, and you can just relax. Okay. This one and this two. Okay, you can sit up for me now. Next, I'm going to be listening to your lungs, which I can hear you breathing, but I'm also listening to your to your heart.
Okay.
But I'm going to listen anteriorly at the front, posteriorly at the back. Okay.
Okay.
So if you can just take a deep breath for me. Hold it. And release. Deep breath. Hold it and release. Okay, just breathe on it. And there's some back here. Deep breath. And again. And again. Okay. All right, your lungs are clear. I didn't hear any wheezes. Didn't hear any fluid anywhere. They're equal, meaning that they sound the same on both sides.
Okay.
Okay, and your respiratory rate as you were breathing, I was timing it. Normal was 10 to 20, and you were right there in the middle at 14.
Okay.
Okay. Next, what I'm going to be doing is I'm going to be taking a. I'm just going to assess your blood vessels. So,
Okay.
so what we do is we just feel and we listen. We have arteries and we have veins, and so what we listen to and assess are your blood vessels and your veins and your arteries. Here in your wrists. Has anybody ever taken your pulse in your wrist?
Yeah, I believe so.
Okay. So what we do is we just feel for your heartbeat there. Okay, in both places. You have normal pulses. We call it +3s.
Okay.
Radial pulses. Can you slide your arms out of your sweatshirt for me, please? Up here, they're called brachial pulses.
I got a fuzz ball, so.
Okay, I'll hold your arm here. And feel here. Brachial pulse. What I'm feeling for is just that the pulse is there, how strong it is. Okay. And then I'm also feeling that there's nothing abnormal, like what we call thrills. Okay. The bubbly vibration I was telling you about before. Okay. So I'll say +3. No thrills, no bruises, and now this side if you don't mind. And I'll hold your elbow here. +3s. No thrills, no bruises. Okay. Next, I'm going to be...
Give me 1 second. Oh. Dropped my phone.
Sure. Take your time.
Sorry.
Oh, that's okay. No problem. Next, I'm gonna feel for your carotids.
Okay.
Here, about at your neck, and I'm gonna listen with my stethoscope, and I'm also gonna feel them. Okay. Here we go. You do it one at a time. You do them together sometimes, and make you pass out. I feel them both. Okay, they're both +3s. No thrills, no bruises.
I could feel it when you do that.
Now I'm gonna listen. Okay.
Okay.
I'm looking at your jugular veins. You don't have any jugular vein distension on either side. No thrills, no bruises. One thing I do want to check is I'm going to listen to your heartbeat again, and I'm going to feel at the same time to make sure that they're beating together. And as I hear it beat, I feel it beat at the same time. Okay. And also too, I meant to tell you I didn't hear a murmur.
Oh, okay. Good.
And I'm sure that your family doctor listens for that all the time every year if you were ever diagnosed with one, okay? All right, now, if you wouldn't mind, if you'll lay back down for me, there's also arteries in the groin area. They're called the femoral arteries. So I'm going to be feeling for those.
Okay.
And I'm also going to be feeling on the back of your kneecaps. They're called popliteal pulses. I'm going to feel for both of those on each side, and then on the tops of your feet, they're called your dorsalis pedal pulses.
Okay.
On both of your feet. So if you wouldn't mind to lay down, either way that's most comfortable for you. Okay. Here on each side, I'm going to be touching here to feel your femoral pulse. I feel it there. Feel it there. Bilaterally, they're +3s, which means that's a normal pulse. It's not weak or it's not too strong, okay? All right, now on the backs of your knees, would you lift up your sweatpants for me? Thank you. And that one too. You just want to relax your knees. I want to feel here for these pulses. And I do feel in both. Okay. And then I'm going to feel here at your pedal pulses.
Okay.
And I feel them both bilaterally at +3. Now here I'm looking at your legs. I'm just feeling for warmth.
Okay.
Okay. I'm feeling that your skin is dry, not clammy. You have no darkening of the skin that would be abnormal. You don't have any swelling, and your skin is intact. Okay. Now, if you want to take a minute and sit up for me here. Alright, I'm also going to take a look at your toes. And we're looking for a return of blood flow. It just means that your heart is pumping blood everywhere it needs to.
Okay.
Okay, and that whenever I press on your toenails, it shows me that you have a proper capillary refill. Okay, your toes are showing me that you absolutely do.
Okay.
Let's see this other foot here. Yep, this other foot is showing me the same. And next I'm going to do your nails. I'm just going to look at them and press on them. And you'll see when I press on them, it turns white.
Oh, okay.
And then it fills back up. Fills back up. Usually we do 1 or 2 fingers on each hand, showing me that you're getting proper blood flow.
Okay.
To your peripheries. Okay. Now that'll be it for the heart and the respiratory.
Okay.
Next, this one's kind of fun. This is musculoskeletal and neurological assessments. Okay.
Okay.
Musculoskeletal, we're looking for, we're looking at your bones and your joints and how your muscles, you know, that your muscles are intact, and that your bones and your joints all look as they're working as they should. And then neurologically, we're looking at, remember when I did your puppy cheeks and your eyes? Those are cranial nerves.
Okay.
Okay, and we're going to be testing the 12 of them today. So they're kind of fun little exercises. So bear with me here. First, we're going to start with musculoskeletal. Okay. We're just going to be inspecting, like I said, joints, bones, muscles, range of motion, and that everything looks to be working as it should. Okay. And first, we're going to start out with your neck, and I'm just looking to see, again, that your neck is symmetrical, that there is no swelling or anything that would look abnormal. And then I'm going to test the range of motion in your neck. So if you'll turn your head to the side and straight ahead and to the other side. And whenever I put my hands here, I'm going to keep you from turning your head. So do that for me. Okay? And on this side. Okay, very good. I'm going to push here and you try to push into my... Okay, very good. Look up at the sky, please. And put your chin to your chest. Okay, that just shows me that you have proper range of motion in your neck. Okay, do you have any issues that bother you, joint-wise or muscle-wise, anything that pains you?
No, ma'am.
Okay. Now next we're going to be doing your shoulders.
Okay.
And basically I'm going to put my hands here. Well, actually I'm going to pull this down a minute, and I'm just looking here again at the symmetry of your shoulders, looking for anything abnormal. Your shoulders they sit correctly. Sit up really straight. Okay. Now show your shoulders for me. Okay. Now try to keep me, or whenever I press down on you, you press up against me. Okay. Very good. Very good. Now put your arms straight out for me.
Can I pull these back up, or do you?
Sure.
Okay.
Sure. Straight out, straight to the side, straight up, and straight back. Straight back down. Okay. I'm just testing the range of motion for your shoulders. Make circles. Okay. And now roll your shoulders for me. Okay. Very good. Next, we're going to be looking at your spine.
Okay.
I'm going to ask you to stand up, touch your toes, and what I'm going to be looking for is I'm just going to run my fingers all the way down. I'm going to be looking at the bony prominences of your spine, and to rule out anything that's not symmetrical or anything out of the ordinary. Okay.
Okay.
So if you'll bend over and touch your toes, I'm going to scoop this back for you. Okay.
Do you need this off, or?
No, I'll just.
Okay.
I can.
Touch my toes?
Yes, please. Okay. I'm just going to lift this up. I'm just going to be looking at your spine here. Feeling all the way down for anything that feels out of the ordinary. I'm looking at the curvature. I'm looking that both sides are symmetrical. And everything looks good. You can stand back up. Okay. Now, while you're standing.
Oh, okay. Sorry.
Oh, that's okay. Into the side for me, side to side. I've already bent over and touched your toes, and now look up. Okay. While we're here, we're going to do the Romberg test. If you'll go ahead and, before you close your eyes, stick your arms straight out. Okay. Close your eyes. Just looking at your balance. Okay. Very good. And while you're up, if you wouldn't mind, if you will go ahead and I'm just going to look at your walk. It's called your gait.
Okay.
And I just want to make sure that everything looks intact as far as balance and everything like that. So if you'll just walk straight ahead, heel to toe. Okay, and turn around and walk back for me. Okay, very good. Alrighty, you can go ahead and have a seat here.
Okay.
Yeah. Now, arms and elbows. I'm just going to be looking at your arms. I'm going to look at your elbows. You've already looked at your shoulders. I'm going to look at both of your elbows, and I'm going to look at your wrists and your hands and how everything fits together, okay?
Okay.
All right, so if you wouldn't mind, we'll start here with your left arm. Okay. We'll be looking at your elbows. Looking for anything out of the ordinary. Bring it up for me, straight out. Okay. There's a reflex here in your elbow.
Oh yeah.
You feel that?
Mhm.
Okay. All right, I'm going to move down here to your wrist.
Is the reflex in your elbow the funny bone?
I think it has something to do with it.
Where
Yeah.
if you hit it and
Yeah, and it kind of tingles
And
and
jerks your
it's
arm,
numb.
yeah.
It jerks your arm. Yes. All right. So I'm just feeling at your wrist here. An ulnar and radial deviation. Extension, flexion. Flex up with your wrist. Flex down. You're making the fist for me. Any tenderness in your fingers?
no
Your
ma'am.
joints? All right. Let's see. Let's do the other arm. I'm gonna look at your elbow and your wrist. Have you been having a cold?
Yes, I'm sorry. It's like the seasonal allergies.
Do you have that every year?
Not really. Some, yeah, a
Yeah.
little bit. Not bad though. Usually just get a cough.
All right.
Maybe sometimes a runny nose.
You tell me. Relax your arm. You tell me.
When you hit it.
When,
Oh,
okay.
yeah.
Okay.
There it was. Right. Yeah.
Yeah. There it is. All right. There's your joints. I'm gonna move down here to your wrists. Put your hand down. Put it up. Okay. Go around. Okay. Just feeling the bones and the joints in your hands and fingers. Okay. Make a fist for me. Okay. Take both of your hands for me.
Can I put this back up?
Yes.
Okay.
Take my fingers, squeeze as hard as you can. Well, not as hard as you can. I'm just making sure that your grips are equal and that you have strength in your hands, okay? Let's see. Press against my hands, okay? Now I am going to keep you from pulling back. So if you want to pull back with your hands, just show me. I'm going to cause some resistance.
Okay.
Okay. Let's see what else. Now, everything looks good on your elbows and your wrists and your hands. Next, we're going to test your hips.
Okay.
If you will stand up for me.
Love you, buddy.
I'm just going to feel your hips here. I'm looking that they're symmetrical. Alright, now, if you wouldn't mind, lay down on the couch.
My head this way or this way?
Sure, whichever's good for you. Okay,
Okay.
down. Alright, now lift your legs up in the air for me, both of them together. Okay, put them down. And now, sit up for me. And I'm going to look at your abdominal muscles. Like do a sit up. Okay. Very good. Alright. Now, with your legs while you're laying, I'm just going to be looking at your knees. Looking at your knee joints here. Be looking at your ankles, your ankle joints. we're gonna test some of your reflexes when you sit back up.
Okay.
Alright? Alright, you can go ahead and sit up for me now. Okay. Alright, put your feet on the floor. Scooch up to the edge. Alright, lift your knees up for me. Okay? I'm gonna give you resistance. Now you put them down while I try to keep you from it. Press down. Okay, very good. Alright, I'm gonna do the same thing with your ankles and your feet. Just gonna test the strength of them. So if you could, if you don't mind, you could lift your ankles up in the air.
Okay.
And I'm gonna cause resistance. Okay? And now push them towards the floor. Okay, and I'm gonna press up against them. Okay, very good. Alright, so we looked at your legs, ankles, feet. One thing with your feet that I want to do is I just want to look at the soles of the feet and your arch. Okay. And I've looked at your toenails and each toe. Crinkle your toes for me. Okay. Put your toes up towards the air and lay them back down flat. And again, crinkle your toes for me. Up in the air, down normal. Looking at the soles of your feet and the arch. Okay. And next thing I want to do is I want to test the reflex in your knee.
Okay.
Okay. So if you'll just relax and your feet are dangling here in your knee, you'll just relax your leg. I'm going to hold it and you just relax it on my hand. Okay. Okay. And then here again. And you can feel it almost. It kind of tickles and alright, very good. Okay. Alright, so that concludes our musculoskeletal assessment.
Okay.
Are you having any problems with any of your joints? Any pain when you run? Any muscle pain, stiffness, weakness, anything like that?
No, ma'am.
Okay, well next we are going to do a neurological exam.
Okay.
And I need to ask a few questions. Do you have any headaches?
No, ma'am.
Blurry vision?
No.
Loss of vision?
No.
Any tingling or numbness anywhere?
No.
Okay. Have you had any dizzy spells or fainting?
No.
Okay. Any memory loss?
No, ma'am.
Any difficulty swallowing?
Nope.
Okay. Any changes in behavior?
No, ma'am.
Okay. No loss of muscle function?
Mm-mm.
Okay. Or any family history of any neurological diseases?
No, ma'am.
Okay. All right. Well, what we're going to do first is I just want you, I'm just going to get a feel for your orientation. Tell me your full name,
Kylie J.
your
Dowles.
date of birth,
3/11/99.
who's the president.
Trump. Donald Trump. Why did that take me a second? It's Donald Trump.
Who was the president before him?
Barack Obama.
How about before him? Don't remember? You're young.
Was I alive for another president?
Yes.
Who was it? Bush. Oh, Bush.
Do you remember any of that?
Yeah.
Okay. Okay. Tell me what is similar about apples and oranges?
They're both fruits.
Okay. How about what's the same about an ocean and a lake?
They're both bodies of water.
Okay. Count by tens to 100.
10, 20, 30, 40, 50, 60, 70, 80, 90, 100.
Okay. Alrighty. Read for me A. The sentence on A.
External nose, size, shape, and color. Palpate for tenderness, bone or cartilage displacement, and masses.
Okay, very good. Alright. So tell me, if you were walking down the street on a sidewalk and you look down and there's an envelope that is addressed and sealed and stamped, what would you do with it?
And it was just on the side of the road.
Well, you're walking down the sidewalk and you happen to look down and see someone's dropped their envelope, but it is addressed to someone, it's sealed, and it's stamped. What would you do with it?
I'd pick it up and can you give it back to the post office?
Yeah, you could do that,
You
or you could stick it in a mailbox.
But what if that address wasn't close by?
No, you wouldn't have to take it to that address, but it already has a stamp on it.
Oh,
So
so
you
you
could-
just drop it off in the...
So you could drop it off in the
Oh,
mailbox.
okay.
You could take it to the post office. Okay. I'm gonna give you 4 words,
Okay.
and I'm gonna tell them to you. And here in a little bit, I'm gonna ask you to remember those words and tell them back to me. Okay. Burger, tulip, nose, and teeth.
Burger, tulip, nose, and tea.
Just those 4 words, and later on I'm going to ask you to remember those. Okay? Alright. How'd you celebrate your birthday last year?
Dinner and a movie with my family.
Who all was there?
Me, my brother, and my mom.
Okay. Did you have fun?
Yeah, and then a bunch of my friends and my family came to the dinner.
Oh, that sounds fun. That's good. Okay, listen. I want you to close your eyes, and this is just called graphisia.
Okay.
Okay? You're going to close your eyes, and I'm going to write on your hand with my finger a letter or a number. Okay? And I want to see if you can recognize it, okay?
A. Three. S. 5.
Very good. Okay. Now, I have some common items here that I'm going to ask you to close your eyes and you tell me what I put in your hand, okay?
Okay.
Close your eyes and open out your hand for me, one of them. I'll put this in your hand. You tell me what it is.
Is this, clothespin? No, this is a paper clip.
Yes, very good. Okay, now open this hand and tell me what this is.
Toothpick.
Yep, a toothpick. And one more time.
This is a paper clip.
No.
Not a paper clip, a clothespin. Keep getting those. Isn't this what they call that?
Safety pin.
Safety pin.
Yeah.
That's what I meant.
Yeah, very good. Okay.
Are we putting something in this thing? No.
Next, I want you, I'm going to touch you, okay? And you point to where I touch you. Okay, very good. All right. Next, what we're going to be doing is I'm going to touch you with 3 different things. It's either going to be a soft touch, a sharp touch, or a dull touch.
Okay.
Okay? And I'm going to be touching you in different places. And I want you to tell me
Soft.
if it's
Dull
soft,
or sharp.
dull, or sharp. Okay? Alright, so close your eyes.
Sharp.
Okay.
Soft.
Okay.
Dull.
Okay.
Sharp. Sharp.
Very good.
Dull.
Put your hands up flat for me.
Sharp. Sharp. Dull. Soft. Dull. Sharp. Soft.
Okay, very good. Okay, now close your eyes and give me your hand. Okay. You tell me which position your finger is in. Okay?
Up. Down. Up. Down.
Okay. I'm gonna do your toes.
Up. Down. Down. Up.
Oh, very good. Okay, now next we're going to be doing some cranial nerves, okay? I already tested your olfactory nerve, but you can open your eyes.
Oh.
I already tested your olfactory nerve earlier when we assessed your nose because I asked you to smell. Okay, that nerve makes sure that your smelling is intact. Okay. Next, I'm going to get you to close your eyes, and you tell me if you can feel this.
Yes. Oh, in the culture. Yes. 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 Yes.
Yes. Okay. All right. I had you to read something earlier, and we were checking your optic nerve. I had you to read something earlier to me, and it said, external nose, size, shape, and color, palpate for tenderness, bone, or cartilage displacement and masses. And you read that perfectly to me, okay? Oculomotor, we're going to test again for the big H. You look at me, you follow my finger with your eyes. Okay? Again. Okay. Very good. We tested your the constriction of your pupils with the light, and that is cranial nerve 4. Okay. The trigeminal is, I want you to close your eyes and touch your face. Okay. And with the other hand. Okay. Very good. And bite down for me. Okay. Very good. We got you before to smile really big. Puff out your cheeks. Don't let me push air out. Okay, very good. We tested your acoustic nerve, which I occluded one ear and whispered in the other ear. And I said elephant and watermelon. We did the Weber test with the fork and the Rhine test.
Mm-hmm.
We also, too, are going to test your nerve 9, which is a light source. With a light source, I was looking at your uvula back here and got you to say ah, okay, and stick out your tongue, lift up your tongue, okay, that's intact. And your vagus nerve, cranial nerve 10, when I was looking at your uvula to make sure that it was in the center of your throat and that it lifts when you say ah. Hypoglossal nerve, cranial nerve 12. Move your tongue around. Okay. Say kite.
Kite.
Light.
Light.
Dynamite.
Dynamite.
Okay, very good. Okay. Now next what I want you to do, we're going to be testing cerebellar function. I want you to take the heel of this foot and run it down the shin of that leg. Very good. Now do it again on the other side. Very good. Now, I want you to put your hands in your lap for me, and I want you to flip them over, flip them back. Do that as fast as you can. Very good. All right. observed you walking across the room when we were looking at your gait and your walk, and you did the heel to toe walk. And we did the superficial touch.
Yes.
Okay, soft, dull, or sharp. And we looked at your fingers and toes, and you knew whether they were going up or going down. Okay, and it looks like today you're perfectly intact, Miss Stiles.
Thank you.
And I appreciate you taking time with me today to do your head to toe assessment.
Thank you.
And I hope to see you soon.
Bye.
Bye bye.